Hello, you're listening to the latest season of the COVID Inquiry podcast. This week, Nicola is joined by Lorelei King, actor, screenwriter, narrator, and most pertinently, a member of the COVID-19 Bereaved Families for Justice group. Together, they're going to reflect on how the recent hearings went and look forward to the next few days of evidence. Please note, some listeners may find the contents of this podcast distressing.
Hello everyone, I'm Nicola Brook from Broudie, Canter solicitors, and my role is I have day-to-day responsibility for running our team's participation in the COVID inquiry on behalf of COVID Bereaved Families for Justice UK, and this is our podcast in which we look back on the evidence heard in the inquiry this week. My co-host is Lorelei King, who is a member of the COVID Bereaved Families for Justice group. And joining us on our panel today are another member of the COVID Bereaved Families for Justice group, Professor Naomi Fulop, and she is here to help us with some of the science evidence discussed this week. Returning to our panel is Enda McGarrity from PA Duffy Solicitors, and he acts on behalf of Northern Ireland COVID Bereaved Families for Justice. And joining us for the first time is Jane Ryan from Bat Murphy Solicitors, who represents long COVID kids, long COVID SOS, and long COVID support. And Jane actually has long COVID herself, so has first-hand knowledge of the impact of this terrible disease. Welcome, everyone.
Thanks, Nicola. Good to be here.
So glad you're all here. And I know that the bereaved families are so grateful that you all take the time to clarify some of the things that we hear each week. This week was insane. I mean, there were so many themes to talk about. Herd immunity, the delay of lockdown, eat out to help out, huge, weak leadership. But because we have the scientists in, and they're always really good value, hugely important witnesses. And this week, a recurring theme I noticed with them was the lack of basic knowledge, that a lot of problems were caused because ministers simply couldn't understand the science or the math or graphs. Naomi, as you're our professor, I wonder if I could come to you to talk about that a little bit.
Sure. Yeah, that was really interesting insights, I think, for people not involved in that world about how decision makers or decision takers, as Angela McLean referred to them, and politicians often don't have a good understanding or background in scientific method, scientific concepts, which the witnesses talked about how that made things more difficult in terms of reaching the right decisions. Maybe, I mean, it's interesting to know whether that was maybe overplayed in terms of how much was it their lack of understanding and how much was it reluctance for other reasons. But anyway, it's very interesting, I think, that Patrick Vallance talked about the former Prime Minister Boris Johnson being bamboozled by concepts like doubling time, and he had to keep explaining to him what it meant. And of course, the important thing about that is it's really important to understand that, because as Chris Whitty and Angela McLean, I think, elucidated really well, you can go from very small numbers to very, very large numbers of infection very, very quickly. And so that's why it's really important to understand that concept. I think also, if I can mention, I thought Angela McLean was really interesting on the cultural differences between academics and civil servants, which had me chuckling, I have to say. So she said, us academics, it's true, we start with the question of what have you got wrong, which sounds very unfriendly. But to give a kind of context, when we write an academic paper, we have to include the limitations. So, we have a heading, limitations, and then we specify what the limitations are of the work that we've done. And that's really important. And when it's then peer reviewed, they might come back and say, you haven't you haven't said this limitation, that limitation. So that's quite different culturally from quite a lot of other sectors where it's all about saying, oh, we've done this and it's really great and so on. And she talked about how civil servants, at the beginning of a meeting or during a meeting, they'll stand up and say, oh yeah, I agree with everything that's been said. And that's a kind of way of building kind of trust and relationships and so on, which is really important. But it's just a very different culture. And I thought that was a really interesting insight.
Yeah, thanks. I agree with you about Angela McLean. She was particularly interesting. I know one thing that has been upsetting this week is a lot of the evidence about just the callousness of what was said. And I know just by monitoring the chat groups and so on and talking to other bereaved, and Naomi, maybe you'll agree with me, is just how upsetting it is to hear things like let them die, all these things that are purported to have been said. And I think, I don't know if I'm shocked, but to hear the attitude of the people who are leading us, for example, if I talked to you, Jane, about long COVID, and I think what we heard was distressing, how it was just dismissed as some kind of mental aberration or mental problem. I wonder if you could talk about that.
I mean, yeah, completely. I mean, it's something that, people with long COVID have all experienced, really. And so, and I speak as someone who has it and has also, represents a large number of people with it in this inquiry. But it's well established that now that Boris Johnson didn't believe in it and had this, long skepticism about it. And I think it was very, it's very disappointing for my clients to hear Chris Whitty's evidence that it was put to him, why didn't you disabuse Boris Johnson of his disbelief in non-COVID? And he said, well, I did, give him some advice when it was material, but it wasn't material in 2020, which I just think is an extraordinary position for a chief medical officer to take. It's obviously relevant. You've got a very dangerous virus that causes death, obviously, very serious acute illness, but also long-term harm and morbidity. And it's very, very surprising to hear Chris Whitty say that.
There was a lot of things that Chris Whitty said that weren't very popular with the people I've talked to. I think, and as usual, and I'll come to you now, we had a discussion about the devolved nations. And I don't know, was it my imagination or when Whitty, again, was questioned by Peter Wilcock, KC, there was kind of a testy exchange between the two of them about politics. Did I misread that?
No, I think that's right. And surprisingly, actually, Whitty voluntarily went into the political realm when really he was being asked a question about science. So Peter Wilcock, member of our team, obviously had put a WhatsApp exchange that the Northern Ireland Chief Medical Officer and Whitty had on the 10th of March 2020. And Michael McBride, the NI Chief Medical Officer, had said, I not only have to secure UK-wide agreement, retiming, but also north-south. Otherwise, we risk mixed messaging and confusion and so on. So really what he's getting at there is that because of the epidemiological reality of the island of Ireland and the open land border, it's a unique situation in Northern Ireland, and that ought to be considered throughout the UK, whether it's through a coordinated approach, a two-island approach had been talked about in Module 1. So, the question was really about how aware were SAGE of this unique situation and how did that factor into their discussions and advice. Whitty was keen to pass the buck to ministers, saying it's a policy issue. Does not really take account of the fact that ministers are acting on his and SAGE's advice. And I think at this point it's fair to say that you can't simply assume very early in the pandemic that ministers are automatically aware of these epidemiological considerations. There's obviously the political issues as well, but the scientists should be concerned with saying what is the best approach for as far as science goes.
He brought up an interesting. I'm sorry, and he brought up an interesting point about how it might be a good idea to have geographical diversity, I think he called it, with the scientist. I'm not sure Whitty's response was entirely satisfactory.
Not really, to be honest. That particular point was first raised with Valence. Valence had said, to his credit, that there should be more geographical diversity. I think a lot of the scientists are concentrated in around London and that general area. So if you take this particular Northern Ireland point, it stands to reason that there should be some geographical diversity. I mean, the point Peter Wilcock was making to Whitty was that there was no mention of this unique distinction in Sage until I think April 2020, and there was no Northern Ireland representative on Sage until the end of March 2020. So it begs the question, how could they be aware, or was anyone really screaming from the rooftops that this is something that ought to be considered?
I found that exchange quite dismissive, rude, and telling, because they said it was more important to have the best minds around the table than geographical representation, as though scientists in Northern Ireland, Republic of Ireland, Scotland, Wales didn't have sufficient scientific knowledge to be able to contribute. It was almost like a case of, we'll let you come when we feel a bit of tokenism is required. And I just found that quite insulting.
I agree with you. I kind of had an intake of breath when he said that, because that was kind of the subtext. Nicola, while we're here, RKC Pete Weatherby asked about asymptomatic transmission, and he kept pressing why the reaction wasn't stronger when we had evidence from, I think it was Germany in January of 2020, that there was asymptomatic transmission. And what did you think about the witness's response to that?
I think this is an area where Chris Whitty in particular has struggled to really put across what his reasoning was, because it seems clear that decisions were made that weren't right at the time. Asymptomatic transmission was known. We were aware of it. We should have been ringing that bell far louder than we were, far earlier than we were. And I think something Chris Whitty said at the start of his evidence was he was the more cautious of the two compared with Patrick Valence. He was very much, let's wait and see, right up until we got to a point where there was no time left to wait any longer. And I think this is an area where he has struggled to justify the decisions he made. Once you have asymptomatic transmission, I think what he was trying to say was that, well, we didn't know the proportion of asymptomatic transmission. We were never going to know that, because you have to wait until there are symptoms to justify the test, because we had so few tests. And so we were never going to get that data to be able to react to the reports of asymptomatic transmission. For me, that was, you could tell he was struggling to justify himself there, I found.
That kind of thing was really hard. Speaking as a bereaved person who's talked to other bereaved people, I think it's two things. One, to hear how they didn't take more action, because I lost my husband in the first wave. And that's extremely hard to hear. But what was almost harder to hear was that they didn't take those lessons learned in the first wave and apply them to the second wave. Those delays happened again. And I know that evidence was extremely hard to hear for people who lost people in the second wave, because it seems like many of them didn't have to die. But it's also hard for those of us who lost people in the first wave, because it is like this, I'll call it a sacrifice, but the sacrifice of our loved ones' lives didn't even go to help inform something for the future so that it wouldn't happen to happen again. I wonder whoever wants to jump in about to talk about this not learning for the second wave.
So, yeah, I would. So my mother died
Thanks,
in
Naomi.
January 2021 at the height of the second wave. And I completely agree with you, Lorelei, and it came out very, very starkly this week that the lessons were not learned from the first wave. And I think all the witnesses, the scientific witnesses this week were clear about that, and Angela McLean probably the clearest. And in a whole kind of number of ways. So if I can mention Eat Out to Help Out, which just as a reminder was a public subsidy. So this is a subsidy from taxation for people to go inside restaurants. So it wasn't available for takeaways, to go inside restaurants and sit and eat. And this is in the summer of 2020. So, it was £849 million was spent on this. All the key points are that the scientific advisors were not consulted, and they all confirmed that. And they also confirmed that had they been consulted, they would have advised against it, and that it would have, Chris Whitty made very clear, it would have been very obvious to ministers what the impact of that policy was by the summer, because of everything we knew by that point. So I think there's that, and then there's the refusing to do a 2-week circuit breaker in September, which was advised by Sage and by Chris Whitty. And then going into tiers, the tier system, which it essentially leveled up the virus. Again, that was not with scientific advice. And again, Angela McLean made it very clear that the second and third lockdowns were called very late. And that is extremely painful to hear, again, even though one knows it and one felt it at the time very, very strongly. And many people did. And I actually think the population, was screaming for those lockdowns to come in, because people knew, the dogs in the street knew. So yeah, but essentially it's very painful, but it's good that it's really come out very, very clearly. And in the next few weeks, the people that made those decisions will be asked directly about this evidence, I hope, and be held to account for them.
I'm looking forward to that moment. And Jane, I think for your clients as well, I'm sure many of your clients lost people as well, but in terms of long COVID, it must also be equally devastating to realize that they may not have had to be infected.
Yeah, exactly. And before I come to that, can I just say thank you to you both and bereaved families for justice generally for what you do, because it's really valuable and important work. So I just want to recognise that. In terms of long COVID, yeah, definitely. We know the second wave led to huge numbers of people with long-term chronic illness and disability. We know that as of last statistics, 1.9 million people in the UK are living with long COVID. We know from ONS stats the growing numbers of long-term sick, and we know that the government is slashing disability benefits. After a pandemic, it has mismanaged. So, to use McLean's words again, I think some of that is unconscionable. And I hope that that's explored throughout the inquiry. I just wanted to also add on that just that 60,000 of those 1.9 are children. And, I do think it's important that there is some focus on those children through the inquiry and through those, what we say were decisions that could have avoided that harm that you have both mentioned. And I also just briefly wanted to mention on Eat Out to Help Out, and thanks so much for setting that out, Naomi. It was really well put. And just to make the point that Boris Johnson's witness statement was put to Valance and to Whitty and Sunak's statement as well. And there's obviously a conflict of evidence there. And just also to remind you that Claire Lombardelli, who was the Treasury witness from a couple of weeks ago, also said that there was no scientific advice into Eat Out to Help Out. She did say it was because it was part of what she said was a low prevalence time, but also just to flag that while we're talking about it.
I just wanted to make the point about the second wave. and how the inquiry chose to approach the evidence of Chris Whitty, because this was something that certainly struck me and a lot of our bereaved families who were present at the hearing. We essentially had 7 hours worth of evidence from Chris Whitty, and we'd only got up to the end of March 2020. And then within a couple of questions, literally a few minutes, we skipped over waves 2 and 3. Now, wave 2 was far more controversial because by then we didn't have the excuse of, well, this is new, we didn't know what to expect, we didn't have time to get plans in place. All of that, we had all the knowledge from our own pandemic, let alone what we should have taken from China, Italy, and Spain. We had all our own data. We knew how it transmitted. We knew the steps that needed to be taken to get the R number below 1. And yet we still made the exact same mistakes all over again. And it really wasn't until Angela McLean gave evidence yesterday afternoon where she said for her, this was the absolute worst time of the pandemic, because she knew what we all knew, that the lessons should have been learned, and she saw them making the exact same mistakes all over again. And by the way, if there is a fan club for Angela McLean, sign me up. Just by way of reminder, this is the woman who we've seen those WhatsApps, which weren't put to her, which wasn't a problem at all. But this is the woman who queried, who is this F-wit about one scientist, and labelled, we think, the Chancellor as Dr. Death. So she seems to be pretty right on the money as far as I'm concerned.
Yeah, I agree. I'll sign up for that fan club too. And what do your clients make of this lack of learning from the first wave to the second wave?
Very much in the same vein as Nicola. I was very interested in McLean's evidence, and I was interested in and would be intrigued to hear what others think about this term about electrifying scientific advice. It's not quite what I understood scientific advice to be about, but the chair seemed to pick it up that perhaps McLean's advice in September in particular, that, you know, we need this circuit breaker now, maybe wasn't quite given as forcefully as it could have been. I don't really see that as much a problem on the scientific side as the people who are listening to that advice. So I'd be interested to hear what others thought about that. But obviously, our clients are very much of the same view. The science was there. It wasn't this uncertainty that was there early in the pandemic. And they should have went sooner.
Come to our scientists, Naomi.
So I think, that's a really interesting point about the term electrifying. And I think what I found very interesting was with McLean, how she talked about how important it is to communicate the science in accessible ways. And we were shown some graphs. She talked about ready reckoners and so on. And she did say, and I think, I think it's a very important point, that it's us as scientists have to be able to explain what we do. And she is a fantastic communicator. And I'm definitely a fangirl. And that, I think, ultimately the responsibility is with the politicians making the decision. I think the scientists did certainly, there are questions about the lead up to the first wave, absolutely, in terms of what was communicated. But I think in terms of the lead up to the second wave, I think it was communicated firstly, and secondly, as Nicola said, everybody knew, the general population knew what was more risky and what was less risky, and what needed to happen. So I don't think we can put that on the scientists.
I agree. I thought it was like a lesson learned for scientists, which is one of the goals of this inquiry, is to learn lessons. And I thought McLean was very clear about that, saying scientists have to learn to be much more direct and with their advice. I thought that was great. I had a question, I think it's for Nicola, really. It's about Van Tam. And when Pete Weatherby KC was asking, this struck me particularly, he was asking if the requirement for PPE for healthcare workers, if the requirements were lowered, were reduced at the peak of infection simply because that PPE wasn't available. And Van Tam seemed to get very touchy in his response. Again, did I misread that?
Absolutely not. Where I sit in the courtroom, I am very, very close to the witness, and you could see there was a physical reaction to the questioning from our own Pete Weatherby Casey. Pete didn't actually put it to him that the minutes were doctored, so to speak. But Van Tam made it very clear that he refuted that there was any suggestion that the decision was made beforehand. So what we had was, to begin with, COVID was classified as a HCID, high consequence infectious disease. And that meant that there were, Naomi will correct me if I'm wrong, I think a very low number of places around the country that had the sufficient biosecurity in place to be able to treat those patients, but also the labs to be able to do the testing. So at an earlier stage, we had Chris Whitty saying we need to step not the classification of the disease down, but the biosecurity down, so that more labs would be able to conduct the testing, because the only way we were going to get our way out of this was by more testing. That was independent of the classification of the disease. And so we seem to have this suggestion from Van Tam that the decision to downgrade the classification of the disease was taken in conjunction with that decision. And our suggestion was that the consequence of that meant that the PPE that was classified as safe for people to use to look after these patients was downgraded. And so it turns from a respirator which is a surgical mask, to the flimsy cotton masks that offer a degree of protection, but nowhere near what the FFP3 mask would have provided. And our suggestion was that decision was taken on the basis of we don't have enough masks to keep everyone safe. So we'll downgrade the mask that is required that we have enough of. That isn't about keeping people safe. And he did not like that line of questioning at all.
He didn't. And again, it was devastating for someone like me to see, because when I saw the initial list of equipment, it was really comprehensive. And having witnessed, perhaps it's not quite the same because I'm talking about healthcare assistants, but having witnessed in my husband's care home, people using little thin bin liners on their arms because they didn't have anything to protect, and dinner lady aprons. And if they were lucky, a blue paper mask. I mean, it's horrific. I mean, Naomi, what did you think of that particular exchange?
So I think it was very enlightening, and it's absolutely clear to me that decisions were made because we didn't have enough PPE. My mother was one of hundreds of thousands of people who cared for in their own homes by carers. And in March and April, they had no masks. They weren't given masks till the beginning of May 2020. And in that first week of May, my mother was sent 21 masks to give one each to a carer as they came through the door. And at the end of that first week, the policy changed, and they had one per shift. So they were going from frail, vulnerable person to frail, vulnerable person for 8 hours with the same thin medical mask. And when I rang up the care agency, it was because the change in policy was by Public Health England. And it was because there wasn't enough PPE. And it's similar in care homes. And in people's own homes, we don't even know the numbers who died of COVID.
I just wonder, I'm going a little bit to the side here because I don't understand this, or I don't really know enough about it. And this is about Simon Case, who was the first, I guess, the first secretary to Boris Johnson. And he is not coming in to give his evidence because he's unwell. And I just wonder, Nicola, if you could talk a little bit about that and why, and can he be compelled, and can we know why he can't come?
So Simon Case, very high up in government, currently, I think the highest civil servant in the country. He was due to give evidence, I think, on the 8th of November. But we understand he's had to stop working due to ill health. And the chair has ruled that she is satisfied he can't currently come to give evidence due to ill health. And there's actually a restriction order in place about his precise health conditions. We don't know everything. We know a small amount. But there has been a suggestion that when he does return to work, that will have to happen on a staged basis. And that at that point, a decision will be taken about whether he is well enough to come and give evidence. And if so, they will convene a separate special hearing to hear his evidence. So we're in a wait and see cycle at the moment.
Yeah, thanks for explaining that, because I know there's been quite a lot of curiosity about that. I just wonder if each of you, if I could ask you about your standout witness or your standout moment from this week's testimony. Jane, maybe you could talk to us about that.
Perhaps wholly unsurprisingly, my standout witness was McLean, because as everyone has said, she's a great role model for women in STEM. I thought she makes me want to be a mathematical biologist. But in terms of standout moments, there was a lot of standout and quite shocking and upsetting evidence that we've heard, I think. But I think one point that Whitty made, which was good and an important sort of political point, was about the operational capacity of the NHS being consistently defunded and undermined over many, many governments and many, many years. And I think that's a really important point that I hope the inquiry takes note of, and I hope the government takes note of, because we must protect the NHS.
Thank you. Enda?
Yeah, I would have to agree in terms of standout witnesses, probably Angela McLean in relation to her refreshing openness and transparency. Also, Whitty was very interesting for us, but more because of what he didn't say or what he failed to address in relation to that relationship between central government and the devolved nations, in particular Northern Ireland. And one particular contradiction in the initial response policy came out, and that was in a report which identified a gaping hole in the government's plan to manage infections from other countries. Obviously, we remember the 14-day isolation rule for those who were travelling into the country, but there was an exception for those travelling from the Republic of Ireland, which in practice meant that someone could travel from a country, say New York, with a high incidence of COVID, come into Dublin, jump on a flight and go to London and not have to isolate. So that, I think that laid out in black and white that contradiction.
Yeah, I remember that moment. That was quite something. Naomi?
So yeah, I will join the consensus around for Angela McLean being my witness of the week. Definitely. I think her clarity of expression, I think she was helped by having an excellent counsel who was questioning her, who was also refreshing in terms of being on top of her brief and asking the right kinds of questions. And I think McLean, she speaks truth to power, and that's very heartening. She's our current government chief scientific advisor, and I feel very heartened and good about that. I just want to agree with Jane about, I think, Whitty's evidence about, and maybe it wasn't electrifying, but in what he said about that we didn't have the capability, as Jane, as you said, in the NHS, but also in terms of scaling testing. The UK developed a test for COVID in January, the same day as South Korea, and they scaled up to be able to do thousands a day, and we didn't. And there are, big questions to be had about that. So, but so much important evidence this week, which sets us up for the next few weeks, I think.
I agree. There were so many moments. Again, I have to join the Angela McLean fan club. She was very human. She was funny. And I too am heartened that in her position, she doesn't care if she will criticize the government if that's what's required. I thought she was terrific. Nicola, for you, who was it?
I agree with everyone. Angela McLean was definitely witness of the week. In terms of the evidence that has disappointed me the most this week, Chris Whitty and his answer to what was your messaging about long COVID, and it was, well, just don't get COVID. Jane will probably be able to speak better on this than I can, but something that has always struck me about this is there was a lot of talk about how COVID is only dangerous to older people or people who were frail, vulnerable, underlying health issues. Generally, younger people were told, you don't need to worry about it. If you get it, you might be sick for a little while, but then you can go on with the rest of your life. I fundamentally believe that if younger people were told, but there is this other thing that you need to be concerned about that could A, not kill you, but B, destroy the rest of your life, or have an absolutely devastating impact on the rest of your life. I think younger people needed to be told that to be able to think, okay, well, this is something that I do need to take on board and think about in how I act. So that was one disappointing piece of evidence. The other is a witness who we haven't spoken about yet, and that's Kemi Badenoch. Some of what she said was just unbelievable. Her unwillingness to accept structural inequalities as an underlying reason as to why there was a disproportionate impact on Black and ethnic minority healthcare workers in the first instance, but also just the general population in the second. Also, she made this startling comment about when she was being questioned by Danny Friedman KC on behalf of the disability rights organisations. He said, why is there no mention of disabled people in the report? And she said, well, it doesn't make mention of older people either, but that doesn't mean they were neglected. Well, I'm sorry, they were neglected. That is a massive part of why we are here, because they were absolutely neglected. And how she was able to make that comment in good conscience under oath, I just, that blew my mind.
Can I just add on Kemi Badenoch, and thank you for raising that. I think totally agree. And I thought the questionings from Leslie Thomas KC and Danny Friedman KC were excellent. But she also said that, that it didn't matter that they didn't consider children either, which is also a theme that we've heard from other witnesses about the failure to consider children separately, which I thought was also interesting. And fully agree with what you've said about public health communications about long COVID. It was extraordinary that I think it sort of speaks to some of the points other people have been making about a bit of a scientific arrogance from Whitty, because obviously, he said, I'd need it spelled out why specific public health information on long COVID would be necessary, and just think, well, of course it would be. Like, what do you mean? Because if parents and otherwise healthy adults are going to make risk assessments to, manage their risks, then they need that information. So it was extraordinary.
To come in on the discussion about Kemi Badenoch's evidence, which was extraordinary, I think is a very good description. So to add to the list of extraordinary things, she said poverty can't be eliminated. And then disappointingly, that was not challenged by the KC, because some of us, I was screaming at my computer screen at that point, and various others, that she should have been challenged on. And I just wanted to link that to the really important point that Angela McLean made, and really, really well, about challenging what she calls the paradigm of the trade-off between public health and the economy, and that there isn't one. And she gave the example that we have evidence of countries that kept infection rates low, that had a lower hit on their economies. And that's a really important lesson going forward, which I hope will really push to ensure that that is included in recommendations and future government action.
Coming back to your point, Naomi, about Tammy Badenoch, I agree when she said we can't cure poverty. We have no cure for poverty. I thought, there's the campaign slogan. I mean, I thought it was a very unwise thing to say, because surely that's the kind of thing that comes up in campaign promises. Just to finish, I mean, Nicola, next week, big week, timetable's been published. What are your thoughts?
Next week, we are sitting 5 days. So we start off with the mayors, Sadiq Khan, Andy Burnham, Steve Rotherham. So it will be good to hear some northern voices and the issues that were going on in the northwest of the country. We then move towards Dominic Raab. We've got Michael Gove. We've also got one of the scientists, Jenny Harries, being called next week because she couldn't fit into the timetable for this week. So we'll have a little bit of science. And then we will end on Thursday and Friday with Matt Hancock, who for a lot of people is someone who they really want to see be questioned about the decisions he made. And also this theme that has emerged throughout the evidence from almost everyone, that some people have said he lied, some people have softened that and said he was over-enthusiastic and over-promised and under-delivered. So it will be interesting to see how those types of comments are put to him and how he responds.
You talked about how now we're sitting earlier as well. Sometimes sessions are starting at 9:30. We're sitting 5 days a week. The lawyers for COVID-bereaved Families for Justice have consistently said, and I'm sure in Northern Ireland as well, have said there is not enough time for this module. You have not allowed enough time for this module. And I think that's been proven. It needed so much more. Do you agree, Enda? What do you think?
Yeah, absolutely. And it is a consequence of this very condensed timetable that things run over unexpectedly sometimes, and the timetable changes. What's most frustrating sometimes is, as I think everyone has alluded to, when council can't follow up on areas which clearly require a follow-up, and it leaves it much easier for witnesses to fudge the issue. And that will become very apparent, I think, when the more senior government ministers give evidence. So it will be very interesting to see how they are dealt with in the next few weeks.
It really, I mean, this has been going on the whole time, but it really came home to me this week about the lack of time that the core participant legal teams have to question, and the inability to follow up. And also what our RKC Pete Weatherby's told us all along, but actually to see it in action, how Lady Halleck controls what questions are asked. And she's intervened a couple of times this week when she's thought that hasn't been being stuck to. And I found that pretty shocking. But frustrating that we can't follow up on certain things because legal teams have been told, as I understand it, correct me if I'm wrong, what questions we're able to ask.
Yeah, each week, for every witness, we have to put in a Rule 10 application for each witness saying, this is the issue. It's a new issue. It's not on the evidence proposal of what you, counsel to the inquiry, proposed to ask this witness about. This is the question that we want to put. This is the context in which we want to ask it. And here's the piece of evidence that we would like to take the witness to. And for each witness, there could be 5, 10, 50 questions that we might want to put. And then the inquiry will respond and tell us which questions we are allowed to ask. In some instances, we're not allowed to ask any questions at all. And the reasonings are usually CTI, counsel to the inquiry, proposed to cover this subject, or this witness isn't the appropriate witness to ask this question. This is for another module, or there isn't enough time. And the isn't enough time is incredibly frustrating, particularly on days when we've had that answer and finished quite early. But this reasoning, if there isn't enough time, but you set the timetable, we've had no say in it apart from telling you it wasn't sufficient. So they're relying on their own timetable to say there isn't enough time, and that just seems insane. I've never been part of a legal process where it's worked this way, and it's incredibly frustrating.
Yeah, just to add to the frustration, completely endorse what Nicola has said entirely. And just the other point is that ILT will say that they will ask a question on a particular topic and then don't because of the timing issue. And so obviously for us, we've been really pressing second wave, obviously long COVID, but the general issue, second wave 2021 and up to 22. And it's just not being reflected in the evidence at all, which is very, very frustrating.
There are so many people who agree with you, Jane, I know, and talking to the other bereaved, especially who lost people in the second wave. And I just wanted to say again, thank you to all of you for donating your time and your expertise to do these podcasts. And again, to say how much it means to people, especially people who find it difficult to listen to the actual testimony. And they like this buffer that we have. And so thank you from the bottom of my heart.
All right. Well, thank you, Lorelei. Thank you, Jane, Enda, and Naomi for joining us today to help us go through the evidence heard this week. Next week is bound to be even more difficult for all of our clients, but we will be doing our roundup the following Monday on the 4th of December. So as soon as that podcast is released, we will get an email out to everyone to let you know that you can have a listen. But thanks everyone for joining us today.
Thanks for listening to this instalment of the COVID Inquiry podcast. We hope you found it insightful and interesting. If you did, please rate us on the podcast platform you use and share the pod with friends and family who may value this type of commentary. We're looking forward to you joining us next week for more expert commentary, opinion, and insight into the COVID Inquiry evidential hearings.